Welcome to today's presentation, Beyond the Waiting Room, with the benefits of direct primary care. I am your host, Arwen Robinson, Director of Marketing with Advanced Benefits, alongside my colleague, James Perkinson, Benefits Advisor and Account Executive with Advanced Benefits. Today, we're very excited to take you through this presentation. As you have questions during the presentation, please utilize the chat function. We will have a Q&A period at the end of the webinar where we will address any questions that were not answered during the course of the presentation. It's worth noting that this presentation is being recorded. If you do not wish to participate in a recorded call, please disconnect yourself at this time. This webinar is qualified for one SHRM CE credit for participants who attend for the full presentation. Your CE credit will be emailed to you by Advanced Benefits within 3 to 5 business days after the webinar and your full attendance is verified. This presentation is a courtesy service to our clients and friends. It is designed only to give information on the developments actually covered. It is not intended to be a comprehensive summary of recent developments in the law, treat exhaustively the subjects covered, provide a legal advice, or render a legal opinion. Advanced Benefits and its employees are not attorneys and are not responsible for any legal advice. To fully understand how this or any legal or compliance information affects your unique situation, you should always check with a qualified attorney. I would like to introduce our presenter today, James Perkinson. James has been in the insurance industry since 2008 with experience ranging from personal and financial to group benefits. He is very passionate about the changes our groups are making in the healthcare industry. James is a registered employee benefits consultant, a certified self-funded specialist, and has his bachelor's degree in marketing from the University of Idaho. James enjoys being active and outdoors. He's completed several local triathlons and a few Spartan sprint races. He also enjoys being active in the community with volunteer projects, serving on boards and committees for nonprofits in his area. So with that, I'd like to go ahead and introduce James Perkinson. James, I'm going to go ahead and give you a chance to do a quick sound check and make sure that we're in the clear and for you to be able to share your screen. Because you know what? Nobody wants to hear James say, next slide, please, for the next hour. So
that is true. And that was quite the hype of introduction there. It feels nice to sometimes look back and kind of think of all the things you're part of and community and all the fun outdoor stuff we do. So
just consider me your personal hype woman.
Yeah. And back to a few years shy of my law degree. I am also a few years shy of my MD or my doctorate degree for any kind of medical advice. And so, today's topic specifically, I know we're going to be talking about direct primary care, but look at it from a lens from somebody who's in the benefits consulting side of the lens rather than from an actual clinician there. So I am going to share my screen, and Arwen, if you would let me know.
All right, I'm looking at your desktop. There's the agenda. There she is.
Perfect. Well, today we'll really kind of start off with just the agenda and what we're hoping to accomplish today in the next 40-ish minutes that we have left. And I'm a big Simon Sinek fan, so I always like to start with why. Why direct primary care as an employer, learning a little bit more about the how of direct primary care through its functionality, direct primary care versus or inclusive with your traditional insurance plan, how you can implement direct primary care. There are multiple ways to go about doing that, and making sure you're choosing direct primary care provider here. So let's dive into it. So why direct primary care? And this slide specifically is through the lens as an employer. Why would you want to consider offering direct primary care or include this into your multi-year strategy when it comes to your employee benefits package? I think, as we're all very much aware, recruiting and retention is a very big topic. Numbers are showing that our labor market is very tight, and it's only going to continue to get tighter, meaning hiring a new talent and retaining the talent that you do have is going to be contingent upon many different factors. And one of those things being your employee benefit package and those employees feeling like you really care about them. And this is one of those things that I feel passionately about, is direct primary care really really is that access to showing your employees that you care by offering direct primary care. And we're going to get a little bit more into that, but it's a very unique benefit offering right now. There are very few employers who are really going down this at the moment, but I think that this is something that will become more prevalent as we start to unpack this more and employers start to understand the ramifications of adding this to their benefit package here. Right now, I think we're seeing a lot of large employers who can essentially afford their own private doctor. But as we'll see later on in the presentation here, there are many different unique ways that you can implement a direct primary care piece there. Lastly, as an employer, seeing the cost of insurance year over year, just essentially having to pencil in increases in the cost of insurance in your healthcare benefit plans, increasing deductibles, out-of-pocket maximums, those sorts of things. This is one of those offerings where direct primary care, as we'll see, can help in multiple ways when we're looking at that cost of insurance there. So this was really the why direct primary care from an employer standpoint. One of the things I reached out to a couple of the providers, direct primary care providers specifically, that have a really good relationship with, and I asked them the question, why are you in direct primary care? And so this was really quotes that I got directly from the providers themselves. And so this one's Matt Dinsmore, CEO of Direct Primary Care out of Spokane here. And this was kind of the bullet points that he listed. And one of the things that he said also down towards the bottom was, I can go on and on about why. So we kind of limited it to the top three here. So, for one, better care. He saw that misaligned incentives within healthcare were responsible for poor outcomes. There wasn't time for conversations, health education, developing thorough treatment plans. He shared a couple of stories with me of his time prior to being a direct primary care provider that really inspired him to go into this route and share those. He said, I believe I had a patient die of asthmatic attack because one, he didn't have access to same day access to his primary care provider. And two, he was afraid of the ER bill he would require if he went to the emergency room. So he didn't seek care and he passed away in the middle of the night gasping for air. This affected me significantly, Matt said. I think we can all really relate to that when we're looking at what is the cost of going to an emergency room visit and what is our plan design and the unknown costs that kind of come with that. And do I have that in my savings account to be able to afford a lot of money for that emergency room bill? Or am I just overreacting and I'll be fine in the morning, right? That's kind of how I felt about that situation when I heard that story there. Another one, unfortunately, was another poor outcome was when a patient came in to get notification that she had breast cancer, but because the provider was running 20 to 40 minutes late because of their patient load, she had to leave to go back to work. She only had an extended period of time. So she didn't schedule a follow-up. Unfortunately, the provider's office also didn't call her to schedule a follow-up appointment. And she was notified that she had breast cancer 3 months later after that initial diagnosis. So you think about how much longer that disease was going on in her body that could have started a little earlier. But she was notified 3 months later when her symptoms were still persistent and worsening, and likely affecting the outcome of her condition was wait times, rushed appointments, poor follow-up. And Matt believes direct primary care provides better solutions for all of those. So we'll go back to his quotes here. So number 2, misaligned motivations. I recognize the healthcare system was a sick care system. Preventative care, education, and the fee-for-service structure is all designed to encourage access to healthcare when you are sick, and not designed or encouraged financially to promote preventative care. I know that's one of the things that we emphasize in our benefit guides that we put out for our employers specifically, is that focus on preventative care. But I also know during some of our educational meetings, we have to educate the employee to distinguish between a preventative care visit and a diagnostic care visit. And that, unfortunately, is times where we've had people go in because we've encouraged them to do their preventative exam. They find something, which is a plus minus in the sense of positive that they were able to find something and find it a little sooner than if they delayed care. But the minus side of that was now the member has this patient responsibility that they might not have necessarily been ready for when it comes to how much money out of pocket that they were having to now incur there. And that's really what I see here on the fee for service model is employees have this taste of, I go to the doctor and I'm not really sure what that bill is going to end up being. And I think this is where we'll talk more about the direct primary care model and how it's different from this fee for service model here. Number three, his personal take on provider burnout. So the number of patients to provider panel isn't 2,400 like the national average, but more around 600 patients. And now, while that might sound like a lot of patients, if you think every day the doctor's there available for inpatient or in-person appointments, they're available for all different types of communication. So 600 patient load versus 2,400, you think about how much more access to that provider you have. So for him, that meant more relationship-based medicine and less burnout, right? Medicine, your health is one of those things that is top up there with your family, your financials, your religious aspect as well. Health is just right up there. And so being able to have more of a relationship-based approach is really what direct primary care provides. So thank you, Matt, for that. Also have another one from Appleton Clinics down in Eagle, Idaho. And so Dr. Beasley, I chose to transition from transitional insurance model to direct primary care because I value time and connection with my patients. Again, back to that relationship piece. I know I can be my best advocate for my patient and what they need when I am not constrained by what an insurance company will agree to. Medicine should be a collaboration, and direct primary care allows the autonomy and flexibility to walk the path to wellness with my patients. Again, big word that I'm seeing here is that relationship piece. Dr. Fott with Appleton Clinics as well shared, I love the DPC model and how our clinic implements it. As a provider, I am able to offer same day or next day appointments to address our patient's health concern. That availability is almost unheard of these days within the confines of traditional model. We also provide easy communication avenues like telephone appointments, portal messaging, having truly unlimited access to allow patients to feel well taken care of. The level of care a direct primary care allows is the way the healthcare should be. Now, I did a little bit of research on my end, specifically to the note here of the same day or next day appointments. I called a few not direct primary care. I called a few primary care with some of the bigger hospital systems in our area, and I got wait times that ranged from 3 months all the way out to 9 months to get an appointment when it comes to primary care. And that just really speaks, I think, to how much those providers are burdened with, how much work that they have to do in that model as being a provider in that type of system. And this is really where this is a different type of system that allows the provider to kind of step out of that system and move into more of this direct primary care, as we'll see further here. So how does direct primary care work, right? So we talked about the why. So how does it work? So the very first thing is really with the direct primary care, the biggest differentiator that I see is they have little to no administrative work when it comes to filing claims with the insurance company. So what does that mean is they're not having to necessarily go and chart the I heard, I think it was like 17,000 different what's known as CPT codes that they have to bill directly to the insurance company of essentially how they get reimbursed in that fee for service model. And so with direct primary care, as number 4 is shown here, is it's a membership fee where you're paying a flat fee, similar to your gym membership, right? You have a gym membership. You don't pay for every time you go run on the treadmill. For every mile you run, you have to pay a certain amount. For every time you go to the bench press, every rep that you're doing, you're not paying a separate amount, right? Your membership fee to your gym allows you full access to your gym, and basically how much or how little you use it is up to you as a member there. And I think this is one of the things that really is changing the way healthcare can be given to your employees, is because once they start to understand that every time I go to my doctor in a direct primary care setting, I'm not receiving a surprise bill 2-3 months down the road for things that, because I mentioned I have an achy knee when I was there for my preventative exam. So it's really truly that personalized care, number 1 there, where it's really that unhurried one-on-one consultation where the average appointment time is somewhere between 45 minutes and an hour when it comes to direct primary care. When you have a scheduled visit, you're coming up with a game plan. It's more of that personalized approach there where the doctor is able to sit there, have conversations with you rather than having to worry about the chart notes and all those things that they need to file back to the insurance company to get that reimbursement. By having that relationship, that personalized care, you can now really focus on that preventative issue, right? So if I go into the doctor and let's say I love red meat, I have high cholesterol, right? So this is a way that I can directly have that relationship with my provider to say, what are some of the things that I can do to help with my cholesterol numbers, and really coming up with a game plan that comes with that rather than worrying about just here's the medication that is going to help get your cholesterol levels down, see you again next year kind of situation that I've personally experienced because I do love red meat. So that is a thing. Streamlined access. So as the quote in the previous one mentioned, there's 24/7 availability and access to your direct primary care. Many times you see on websites, things like that for the direct primary care clinics that are available. They're available via phone, email, chat, text message. When you have that relationship with your provider, and they're not worried about a fee for service for every time you reach out to them, they're able to really take a look at what's going on. Send me a picture of this rash that you're seeing, and they'll be able to tell you, oh, this is something I think that we can see in the office. Maybe this is something that they do need to refer out to somebody else. Or if there is an emergency situation, you have somebody to kind of check that with and say, hey, I think you really should go into the emergency room. It is worth it at that point in time, because through the direct primary care, again, you're not worried about receiving a surprise bill because you reach out to your doctor in the middle of the night. So how does direct primary care work with and against really traditional healthcare? So as we mentioned previously, that access is because of the less administrative burden that is on the direct primary care providers. They have more time to really have access with their members on a one-on-one basis. We mentioned the cost with the flat fee piece there. So from an employer's perspective, it is predictable cost for you. So you're no longer concerned about receiving bills or, depending upon your funding arrangement, how much claims you're going to be receiving on there. As well as if you really look at the experience rating for anybody who's involved in part of that direct primary care membership, we have a couple people here in our office that has experienced direct primary care as well, and they all give it 5-star reviews. It's just a different way about going your healthcare than the traditional model there. So what are the ways that you can implement direct primary care? So here's a couple of examples here. So the first one is probably the most expensive one, but as an employer, one that you would potentially have the most insight and availability to help control is an on-site or near-site clinic. Now, from what I've been told, this is usually one of those ones that you need about 1,500 employees to be able to put up a clinic, as well as the cost that's considered with implementing a clinic. And that could be several hundreds of thousands of dollars, depending upon if you're doing a full build from the ground up, if you're renovating something, getting the medical equipment in, things like that. That is a possibility, but I think that there are few and far between employers who have the capability to do that. Now, there is also the piece where the near site clinic, where the near site is maybe you're sharing with multiple employers. There's not a direct primary care close by. You're able to use a multiple employers to come together to meet that 1,500 employee minimum that's usually required for putting up a new clinic there. I think my favorite one specifically is the existing direct primary care clinics that are already in our neighborhoods as we speak. And as you see on this map here below, specifically for the state of Idaho, every dot that you see there is a direct primary care clinic that is in our area right now. Now, the different color codes are whether they're an on-site, near-site, is strictly just a direct primary care. If they're a hybrid model where maybe they accept some insurance, but every single one of those dots specifically is a direct primary care in our community there. And I like this model because from an employer standpoint, you're not having to front a ton of money to put up a clinic. there's clinics already exist, and a lot of them do really like to work with employers because they have that relationship piece again. And being able to have that relationship from an employer standpoint in human resources, when you hire a new employee coming in, you can set up that arrangement, give that referral over to the direct primary care provider to get them set up with their very first appointment, and get them integrated into that culture of what direct primary care really is. So some other alternatives there as well is in-home direct primary care. So this would be a model where there is no physical location, that you would essentially be reaching out to a direct primary care provider who would be coming on site, whether that be in your home or maybe in your workspace. If you have the room for it, maybe you have a spare office or something like that they can set up shop there. Again, this is probably a little bit lower since there's not a physical building that they're going to, but this is a little bit more of your preference of how you want to experience your direct primary care. And last, this is can work in coordination with any of the three above as well, is the virtual direct primary care. So having a relationship with somebody just the same as we're doing here, where it's over a teleconference or video chat, things like that. So again, they're not seeing you in person. There's not a brick and mortar place that you're going to, but you have that opportunity to have that relationship with your provider over a call like this. And so that's going to be probably one of your least expensive avenues there, when it comes to from top on-site, near-site clinics being most expensive down to virtual care being your least expensive option to do that. So I want to share a little bit about direct primary care by the numbers. So some of the partners that we work with shared some numbers and some statistics of what are they seeing when it comes to claims cost in the healthcare, that when we understand and know as an employer, when we talk to our benefits advisor about what's our loss ratio, how much money is going out versus how much the insurance company is collecting, direct primary care has shown that they can help drive those numbers down with the engagement that they have with the employees through multiple different avenues here. So as we see here, this is a study from Milliman, so shows that nearly 12.5% reduction in claims cost when you implement direct primary care. And that's really overall. So we start to break down what are some of those additional numbers. So emergency department visits are nearly 40%, because again, back to that model where you have access to your direct primary care provider essentially 24/7. You call them up in the middle of the night and say, hey, I've got this going on. What's going on? Your direct primary care can essentially assess that and help direct you, saying, hey, I think this is something that can wait till tomorrow morning. I've got time on my calendar. Let's get you into our office here, rather than the emergency department being the go-to choice, because I have no other way to get a hold of any other provider to know, is this something serious or is this something that can wait? We also have inpatient hospital administration rates down almost 20% when you add in direct primary care. Again, I go back to that relationship piece that knows, primarily we're driving that relationship through the direct primary care provider. So they're in the know of what's going on with your healthcare to know, do you need to be admitted to the hospital? Is this something that can wait? Is this something that I can help you with? Or is this something we can refer out to a specialist that goes beyond direct primary care? There's also the surgery piece, right? So many times, I personally just experienced this where outpatient surgery is typically, how many of us have back pain, shoulder pain, knee pain, hip pain, all those sorts of things. You can go to physical therapy, all those sorts of things. And a lot of times it's, right, my hip hurts because my back's out of line or my glutes aren't strong enough, right? And so being able to, again, have that relationship with your provider where you're saying, hey, I've got this knee pain. And they're able to really help create a game plan about, okay, this is what I think you should do, whether it be stretching, exercise, all these different things. They're showing that having that relationship again with a regular frequent cadence with your direct primary care provider reduces the need for surgery claims. Here's some additional numbers. This one's specifically from the Appleton Clinic. So thank you, Isaac, for sharing some of these numbers. So this is truly just the employer and employee costs on a per member per month basis. And Appleton, in their 3-year study, showed for those employers that were engaged with the Appleton Clinic saw nearly a 30% less employer plan cost by engaging with the direct primary care clinic there than traditional comparison plan that you see there. And when it comes to the employee cost, you also see a traditional drop there as well. The big thing that I like to see, right, is again back to that fee-based model where you can use it as much or as little as you want. The average number of primary care visits, so actually engaging in your healthcare, significantly increase with that, which, right, you'd think, oh, they're going to the doctor more, they're going to have higher costs. But no, they're taking care of a lot of those acute needs, and preventative care and maintenance before it becomes a bigger issue. There's the Pareto principle that's out there about the 80-20 rule, right? So effectively how that would kind of work in this scenario here is, we talk about the membership piece, and maybe it's like the gym, right? We pay, how many of us have a gym membership where, hey, it's been a few months since I've gone and I'll start next month kind of scenario there. And really it's, hey, maybe it's only 20% of your population that's really utilizing it 80% of the time. But those people are probably the people who need to be into seeing a provider on a regular basis. And they're no longer worried about what's that surprise bill going to be just because I call up my doctor and ask a couple questions, or I want to engage in a healthcare plan there. So that's a little bit of the direct primary care by the numbers there. So here's some advice that I see when you're trying to find direct primary care provider, because as we showed in that map, there are many direct primary care providers that are already out there. So first one is just compatibility. Right? We talk about relationship, and what one direct primary care provider believes in and how they operate might not be the same way that you want to engage in your healthcare, right? And so being able to offer, either multiple choices or find a doctor that's really compatible with your beliefs and how you want to experience your healthcare is very important, because it is that relationship style. There is services offered. So different direct primary care offices from an independent standpoint do offer different services there. So you do want to make sure that that aligns with, if you're a big proponent of doing biometric screenings and things like that, the blood work, the x-ray services, things like that, that they do offer that. Or if they don't, the next question I would ask is, what is their referral source, if you will, for things that they don't necessarily cover? Convenience. One of the things is just calling the office, and how long until you get a call back? Where's their office located relative to where your employees are at? What is their engagement with the digital access, with texting, email, video chat, things like that? If I'm not able to physically make it there in person, tell me about your style when it comes to digital access. And the biggest one, cost transparency. I think this is pretty well, most direct primary care providers are really great about cost transparency. So with your membership fee covers a wide variety of things that they do have. There are a few things that might be outside of the normal cost of that membership. So let's say it's in a very extensive blood draw that they want to do. Typically, direct primary care providers are going to tell you what that cash pay price is up front before that is offered, before that is ordered. So you don't have to worry about what's that bill going to be in 2 months once it applies to my insurance and all those sorts of things. What's that discount going to be? They will tell you, here's the cash price for this type of service that we have. So having that cost transparency, especially when we're talking about that membership fee, is a huge part of the decision-making of choosing the right direct primary care provider. So as an employer, one of your questions you're probably asking is, well, if I'm excited about direct primary care, want to learn more about it, want to meet the docs, all those kind of things, how can I integrate this into my employer-sponsored health plans? And I think there's multiple ways to be able to do this. First one, if you're looking at doing it, is maybe we tweak plan design, right? So maybe we encourage members to engage and enroll in their direct primary care. So if we have the option to be able to say, hey, if you're going to engage with somebody outside of direct primary care model, maybe we do increase those deductibles, those co-pays, just to help alleviate some of that financial cost when it comes to the premium side of things, to be able to offer your major health plan alongside the direct primary care. Because we do believe that you need to have some sort of top layer coverage for those what if scenarios, because they do happen. And things that happen really outside the direct primary care. And those, really the number is about 80% of your healthcare can be seen through a direct primary care provider. So what's that other 20% that we need to have coverage for? And maybe we're tweaking that plan design to be able to fit that into the budget piece. The other side is looking at alternative funding plans. So this can be level funded plans. This can be self-funded plans where really as a plan, you are paying for those costs. And so would you rather pay for it in a fee for service model or more of a membership model where you know what that fixed cost is, and you're essentially eliminating a lot of that question when it comes to what kind of claims am I going to see from that primary care thing. The other piece, really, when it comes to alternative funding, is the referral piece, right? Again, back to that question of choosing your direct primary care. If this is something that is outside of your wheelhouse, outside of your walls, how do you approach that? How do you make sure that we have the highest quality and lowest cost provided for our employees? Because we know, based off of our loss ratio and seeing the data behind the scenes, our money is directly impacted by where our members go and what treatment that they are seeking. And so you're bringing a little bit more awareness when you have an alternative funding plan like level funded and self funded. And then really there's just being able to have employer support to say, hey, maybe this is just a purely voluntary option that alongside that we want you to have access to this. So it's not changing really plan design or your funding mechanism. It's just the employer support to say, we believe in direct primary care. We want to offer it as a benefit for you. Maybe there's a percentage of how much you pay for it, or maybe it is truly a voluntary option, but we're bringing awareness to your employees about that direct primary care.
James,
So,
if I could just for a second,
yep.
just on the previous slide, I think one thing that you touched on, but I just really wanted to kind of echo was that, and we had this question come up is like, when is the savings significant enough that it makes sense for an employer to pick up the cost of that direct primary care membership? And like you touched on like the self-funded or the level funded, right? If you're a self-funded or a level funded employer, it is to your benefit to reduce your claims costs because that's where you're going to see savings. It's a little tough to prove that a claim didn't happen, right? You can't prove that, oh, somebody didn't go to the emergency room and incurred a claim that would have been 3 times as expensive as, what I paid for their direct primary care. So that's where the data, I think, trends over time is that if you're self-funded or level funded, over time, you will see your claims costs reduce. For a fully insured employer, just to kind of echo what James was saying too, is that, if you're a fully insured employer, you have, a greater ability to have traditional insurance with that higher deductible or higher out-of-pocket maximums because the premiums are going to be lower when you have those higher deductible plans. But rather than, telling an employee, hey, here's your health insurance, the deductible is $6,000, good luck. You're saying, hey, we have direct primary care. You can go unlimited to this clinic for as much as you need. And if you need to go to the emergency room, you do have coverage. It's a $6,000 deductible, but again, that's only if you end up in the emergency room or having a big surgery or something like that. And then, that's where that potential savings is in the premium. And then like James said too, from the employee, the employer employee support side of things, you may decide that the added expense is worth it to be able to attract and retain talent. Because we do know too, that James mentioned earlier in today's labor market, that the cost to retrain and replace an employee is very significant. And if you offer direct primary care, you're creating that additional stickiness with your current workforce. So I just wanted to spend just a brief moment kind of recapping what James shared in this to kind of try to bring it full circle to the different ways why an employer might consider adding the expense of direct primary care and when it may be worth it.
Yeah, and I mean, one of the things to add on that is, a lot of this we're talking about the healthcare plan, right? Because being the benefits consultant side of things, that's kind of our lane. One thing that I was also kind of brought awareness to was workers' comp can also be highly impacted by this, by again that relationship that you have with the provider. That if something happens while you're on the job site, that you have that go-to person to refer to say, hey, we've got a workplace accident. Go see our direct primary care provider, have that relationship with that provider to be able to say, what are we looking like? What's this injury? How's our recovery? Things like that versus being able to just send them out there into the healthcare world and getting bounced around between urgent cares, emergency rooms, specialists, all that different things. there. So, and I go back to, can you put an ROI, specifically return on investment, when it comes to, the cost of direct primary care and what you're going to see in claim savings? And the unfortunate answer is it depends, right? It depends on what your health is of your population. If you're fortunate enough to receive data claims experience, that hopefully gives you a little bit of an insight to, is this an ongoing situation where, maybe it is diabetes management or something like that, where it's chronic conditions, where getting somebody engaged with that's going to help keep some of those chronic conditions under control. I think, big things, which is where the health insurance really needs to kick in, is things like end stage renal disease, cancers, things like that. The hope is that the long-term effect of being able to be proactive and preventative, we can catch some of those things earlier, so we have a better diagnosis and treatment plan in coordination with oncologists and things like that, to be able to help that member's experience, the lifespan, productivity at work, all those sorts of things. And so it can go many different ways on how are you going to specifically track return on investment. I am just a big believer that direct primary care is the gateway to a healthier population, because again, of that relationship word with your doctor, bringing back that old school mentality of having a relationship with your doctor that knows who you are, rather than, in traditional settings, those providers are very much overworked. They have a huge patient panel that they have to work through. And so direct primary care does limit the amount of clients that they do take on, and they do it through more of that membership style. So this is our second to last slide here. So, is direct primary care right for you? And this is a lot of what we've kind of already talked about, and choosing to have that personalized care, right? That person to contact, that if you do have, one or two or several different direct primary care, depending upon your population, where people are, working and located at. One of the things I forgot to mention, specifically in the piece of how you can implement it, is there is a feature of being able to build essentially a network of direct primary care doctors that are independent. So let's say I have a company and I have employees out of Coeur d'Alene, Missoula, and Boise, right? So I have 3 different locations that I'm trying to manage. Well, there are programs out there where we can build essentially a network of different direct primary care providers in those communities that would engage those populations for your employees being able to work there. So that's a huge thing when we're just trying to connect with just one in the local community. Maybe we access those different communities and those direct primary care providers there. It all comes back to that personalized and relationship-based care. Cost savings. So depending upon where you're at, where your plan is, if you are what's known as experience rated, where you're seeing how much claims came out of our bucket versus how much premium the insurance carrier took in, can we develop some sort of return on investment by implementing that? Do we have claims data that we can see? Hey, we've got a frequent flyers to the emergency room and urgent care. If we implemented direct primary care, that all but eliminates urgent care. I mean, really, when you talk about what urgent care is an extension of primary care that's not urgent enough that needs to go to the emergency room, but they have that same day, next day access at that urgent care that really direct primary care providers do provide. But again, back to, you're seeing that normal person who sees you on a regular cadence, rather than you go to an urgent care and it's a complete stranger who's trying to get as much information as they can in a short period of time so they can treat you, move on to that next person. And that's really that timely access of 24/7 access. I mean, there's so many times where I can text any of the direct primary care providers that we work with, and really have that access and that communication to say, hey, I've got an employee who needs some help. Can you help them out? And that's really where it makes me look like a rock star from an employee benefits consultant standpoint, where I'm able to add in direct primary care to one of my clients, and they just love that fact. And they don't lose members, because they know if they go to a different employer, more likely than not, they're not going to have that direct primary care relationship that's built into their healthcare plan there.
I
So
feel,
I
James,
would,
like you said, like you just mentioned, it makes the employees very, very sticky. And, it's gonna be one of those pieces that we've seen that somebody, if they're looking elsewhere, that they're like, well, I don't want to lose this access, so I'm staying put.
yeah, I mean, there's many times where we have different unique benefit offerings that are in there that employees don't want to leave. you take that relationship piece with your primary care doctor and you embed that as part of your benefit package. That's a sticky piece there. And so that's really where I'm like, take the first step towards better healthcare. And really that's engaging in finding out more about direct primary care. And that might simply very well be, let's talk to a couple of local direct primary care offices, because I know that they're more than willing to do that. I have had the fortune of actually bringing providers into employee benefit meetings to talk to the employees. That doesn't happen in the traditional model, but obviously you got to plan for that. You can't just call up the doctor and say, hey, I need you in a meeting here in the next 30 minutes. They're busy too, but you get ahead of that. Most of the time, those direct primary care providers, especially if you've got 30 of their employees at one time that they can come in and talk to, they are all about that because it's, again, that relationship piece. So, Arwen, I'll pass it back to you for questions.
Yeah, thank you, James. I think one of the pieces, that you hit on, as far as like the direct primary care is concerned, right, is that, the different options, right? And so I think that sometimes some employers think that there's like a really high barrier, like, oh, well, I'd love to do this, but I can't afford, I don't have $1,500 or 1,500 employees. I can't afford, to set up this kind of shop. And I think that's where, you had briefly mentioned, like, hey, there's an opportunity for employers to collaborate with each other, and I think that, it's like, hey, like for us, for example, we work in a business park, and, it would be a pretty easy conversation for us to be able to, we already talk with our neighbors anytime we have like food trucks or blood drives or anything like that come through the neighborhood. And so, just also think of your business neighbors, that's something that you could potentially leverage with them as well. So I guess my
Well,
question is, James, is like, how, if I'm an employer and I'm going to approach my neighbor on this kind of idea, like what does that conversation look like?
yeah, I think this is also one of those things where, very instrumental for us is developing that multi-year strategy. So maybe this isn't something that's feasibly able to accomplish within, January 1st, 2025, right? We're 6 months away from less than that, actually, from January 1st, 2025. So open enrollment, fourth quarter is here before we know it. And so this is one of those things where we can have a conversation and say, okay, maybe this isn't really something we can implement here, or we can implement it in waves. This is part of our long-term strategy. But if we say that, hey, we want this is maybe where you can work hand in hand with your benefits consultant and or one of those direct primary care providers to say, hey, is there an opportunity for us to kind of come in and do an informational conversation with some of our employer groups? So it's not just me having to have a one-on-one, but we can have a group conversation with your neighbors there, other employers, to say, this is something that we really want to offer to our community. And I think this is something that we can offer here locally within our business district, if you will. And then we're able to come to the table and talk about the benefits and talk about what that logistics would look like by implementing that. And everybody's going to be a little bit unique. Again, back to the plan design, or you doing alternative funding type plans. This is where you kind of need to have that consultative approach to say how best to implement this and what's the best timeline to be able to do that.
Yeah, I know I think, I've heard of other employers creating these coalitions for direct primary care. We've seen more coalitions for like childcare, just employers banding together and saying, hey, we have a problem. And if we band together, we have a greater likelihood of solving it,
Yeah.
than just trying to do it all on our own. Okay. I am not seeing any other questions in the chat. We kind of answered questions as we went along. There was one question about, what if I have to go to the emergency room or access services that are outside of the direct primary care's scope of services. And I think, James, you really, you kind of touched on that and already, addressed it, that is where that traditional health insurance. And so I think it's important to recognize that direct primary care is not, I mean, if you have nothing at all, direct primary care is a great step. But, if you want a comprehensive overall benefits package, you really want to still have that traditional insurance layer for the catastrophic coverage, is, I think, would be fair to say.
Yeah. I mean, the genesis of insurance to start was really intended for those big catastrophic, life-changing situations where, my house burns down, I need insurance there. But I'm also not hitting up my insurance every time I need to change the air filter in my house or I need to have my sprinklers blown out. That's really my responsibility and things that I can do myself. And that's really where I think direct primary care helps be that top layer there, so you can afford really that catastrophic insurance on a different level for those really what if scenarios, that you have that coverage, so that you're not necessarily going bankrupt because of medical bankruptcy, which is the leading cause of bankruptcy, is medical related bills, which is very unfortunate.
Mhm. Absolutely. All right, James. Well, I think that brings us to the end of today's conversation, right at 11:45. We killed it for time management. I just want to say thank you so much, James, for bringing this valuable information to us today. Really appreciate it. We can definitely tell you're passionate about it because you're knowledgeable about it. And if you have any DPC related questions, James is your guy. Um, or, if you're a client of ours, you can always talk to your account manager or your benefits advisor that specifically works for you. And with your renewal, that's always a conversation we're willing to have. But again, thank you so much, James, for your time today. Thank you everyone for attending. We really appreciate it. And again, as a follow-up reminder, once attendance has been verified, we will send out a recap email with the copy of the slide deck, the recording, and the SHRM CE credit for those who attended live. And that'll go out next week. So thank you so much, James, for your time today.
Thank you.
All right. Have a great day, everyone.
Bye.